Hi, this is Mr. Baker, and today we're going to talk about ankle taping. Have you ever wondered how an athlete can go from rolling around on the court in pain after suffering a sprained ankle to turn around and lead his team to a national championship? That's what happened with Mateen Cleaves back in 2000 at Michigan State. Watch this video. The big question today is how can support be provided for an ankle sprain to promote completion of functional activities? So in order to be successful with this unit, it's important that you understand the basic anatomy of the talocrural joint and be able to identify the joint motions. You also need to know the essential ankle ligaments and be able to identify using surface anatomy. And then last but not least, it's important that you understand the mechanisms of common ankle sprains and be able to apply a closed basket weave taping to adjust the injury or instability. Please review these terms and make sure you have a very good grasp of what they mean. Anterior, posterior, medial, lateral, ligament, and functional movement or activity. Now, let's take a look at the bony structures of the talocrural joint. The fibula, outlined in blue, sits on the lateral aspect of the ankle. The fibula is a non-weight-bearing bone. The tibia is the large bone of the lower extremity, oftentimes called the shin bone. This is a medial view of the tibia also. The talus sits distally to the tibia, outlined here in blue. And this is a lateral view of the talus. We know this is a lateral view because here's the fibula. And remember, that's the lateral bone of the ankle. The calcaneus sits posteriorly and is oftentimes called the heel bone. And it's the attachment site for the Achilles tendon, as seen here. Now that you have a very good understanding of the bones, we will start to talk about the ligaments. And ligaments connect bone to bone, providing stability and support. A thorough knowledge of the bones of the ankle will help with the terminology of the ligaments. The ligaments that I'd like you to be aware of are the anterior talofibular ligament, the calcaneal fibular ligament, and the posterior talofibular ligament. These three ligaments are called the lateral ligaments of the ankle. And then additionally, the tib-fib or the tibiofibular ligament connects the tibia with the fibula. The anterior talofibular connects the talus with the fibula, as seen here in blue. The posterior talofibular ligament also connects the talus with the fibula, but this time in a posterior direction. And the calcaneal fibular ligament connects the calcaneus with the fibula. The tibiofibular ligament sits anteriorly and connects the fibula with the tibia and keeps the talus from going between those bones. But how does an ankle sprain happen? Sprains occur when the ligaments are taken beyond their normal length. And this is an inversion mechanism that is impacting these lateral ligaments. Please take some time to view this video on the anterior drawer test that assesses the stability of the anterior talofibular ligaments and the calcaneal fibular ligament. Next, please watch this video that outlines the evaluation process using the Talar tilt test. The Talar tilt checks the integrity of the calcaneal fibular ligament. If the ligaments provide support, what can be done to help the injured lateral ligament so that the individual can perform functional activities? Yes, you guessed it, ankle taping. Please view this video for step-by-step instructions. Please create a sequence chart describing each step in the taping process. Remember to practice, practice, practice.